I'm attending the Society for Breast Imaging meeting here in Las Vegas for 2018. I had the opportunity to speak today, but I had the opportunity to share the podium with one of my good friends and a very well-known breast radiologist, Dr. Sally Friedewald from Northwestern University. And Sally, you gave an excellent talk on tomosynthesis, and I learned so much. Do you want to highlight some of the things you said today about tomo?
Sure. So tomosynthesis is really rapidly adopted in the United States, and so we're seeing the benefits both in cancer detection as well as reducing the false positives with screening mammography. So it's an exciting time, and we're happy to talk about a lot of the benefits of this newer technology.
So what exactly is tomosynthesis? Is it 3D mammography?
Yeah, so those terms get interchanged quite often, and yes, technically we use the term tomosynthesis, but it is what we commonly refer to as 3D mammography.
So one of the things that you highlighted was that it actually picks up a few more cancers than standard digital mammography.
It does, and a number of studies have shown that, and not just the overall population, but in the different density categories of women's breasts, as well as in different age groups. So it really benefits all women.
Well, you know, one of the things that we talked about in the earlier session was that there are harms to screening mammography, one of which is patients being recalled. So what does 3D mammography do for the recall rate?
Well, that's really where the benefit of tomosynthesis is going to be seen year after year. So once patients are screened multiple times on a yearly basis with tomosynthesis, we're calling fewer people back for the false alarms or the false positives. So it's really exciting to have this technology that improves upon the two major criticisms of mammography.
Well, how many tomosynthesis units are there in the country? So what is the percent penetration of this technology?
Well, it's much faster than digital mammography. We now have approximately 30% of the units across the country that are tomosynthesis capable, so it's prevalent all over the place in the United States.
What about insurance coverage? Does insurance pay for this?
Yes, so Medicare started covering back in 2015, and most insurance companies are covering it because they recognize the benefits and the decrease in downstream costs associated with screening. I think there's some outlier insurance companies that may not be covering, but for the most part they are.
Well, I am proud to say that Select Health, which is the insurance arm for Intermountain Healthcare, was the very first private insurer to cover tomosynthesis.
Oh, that's music to my ears. That's wonderful.
And we try to offer tomosynthesis to all of our patients. So anyway, thank you very much, and thanks for a great talk today.
Thank you, Brett. I appreciate it.